Good morning, afternoon, evening, based on where you are around the world, to our breakout workshop. How can cross-corporate engagement address challenges in a post-COVID-19 world? My name is Lawrence. I am the research director for the Chamber of Commerce Foundation, just here to make sure everyone's in the right place, right time. And so for the next hour, we're going to have some folks from Pixera, Husna Ali Khan, who's the associate director at Pixera Global, and Alexandra Smith O'Connor, who is the key client manager, Global Pro Bono, also at Pixera Global, are going to talk about how we can all work together to address these challenges that they're not new, but are in a new context over the past 6-7 months, and will be in a new context moving forward. So again, just welcome everyone. We'll be here for about an hour, and afterwards I'll close us out, but enjoy, and I'll toss it over to the Pixera team. Thank you.
Thank you so much, Lawrence. Welcome everyone. We're going to dive right in here. As Lauren said, my name is Husna Ali Khan. I'm an associate director at Pixera Global.
And I'm Alex Smith O'Connor, key client manager with Pixera Global. It's a pleasure to be talking to you all today.
Thank you so much for joining the workshop. We are very accustomed to doing these things in person and moving around the room and engaging you. We'll do our best to engage you virtually over the next hour. And if we move over to the agenda, I want to talk you through what we're going to do in the first half of the workshop as well as the second. In the first half of the workshop, we will talk to you about the idea of global pro bono, or skills-based volunteering, as you may have heard it called. I'll also talk to you about a new endeavor Pixera Global has called the Reimagine series, and talk about the first challenge within that series, the Reimagining Community Health Systems Challenge. We will also talk to you about a couple of other program innovators from our client base and a few lessons learned that we've learned along the way. That will be about the first half an hour of the workshop. The second half an hour of the workshop is devoted to you. It is indeed a workshop, so we are going to put you to work for the final 30 minutes, and that will be a great opportunity to throw questions, and hopefully we'll throw some great answers your way. So lots of opportunity to engage in the second half, and let's get started. The objectives, what we hope you come away with during this session, is learning about what it means to meaningfully engage on communities, with the community on social issues. When we were putting together this workshop, I think the meaningful was the part that really came to the top. So we're going to get a little granular, especially in, as you see on the right, helping you grasp lessons learned for how to engage with the community during what I definitely think we can all say is a really unique time. As I said before, Reimagine series is going to tell you all about that, including some of the steps we're taking towards impact and solution implementation. And in the workshop, we're really putting you in the design seat, helping you understand from the Pixera Global standpoint some of the foundational steps that we usually take and the questions we usually ask with our clients in designing a community engagement or global pro bono opportunity. So with that, we will head over and do a little dive into global pro bono. And before we even do that, just want to talk a little bit about Pixera Global, where Alex and I are usually based in the DC office, but based from home right now. Our mission is to reinvent how public, private, and social interests engage to solve global challenges. We really like to say at Pixera Global that we're very comfortable and love that spot right in between public, private, and social sector, wearing one another's hats, and helping. The challenge being that we know that companies are under pressure to demonstrate their role in contributing to societal good. We are, our main goal as your partners is to ask you, how can we figure out how your company can be strategically aligned while delivering value to the business, to society, and to your employees. And our goal is really to help you develop and position the exceptional leaders that you have, and enable your company to contribute to societal good. Next slide, please. Great. So what is global pro bono or skills-based volunteering? So essentially, global pro bono is really about unlocking talent for social good that aligns with broader company strategy. In the simplest words, that's what it is. In terms of programmatically what this means, it's really employees leveraging their professional skills on time-bound and deliverable-based projects. How that takes form is a lot of different programmatic models. We're going to go through one big one today, but really their goal is to, while they're is to assist social mission-driven host clients or host organizations, such as nonprofits, social enterprises, government entities even, to really meet their mission and to work on a challenge that is defined by those entities. So what are the benefits of global pro bono? Why engage in global pro bono? First of all, starting off with employee impact, we've basically found that it's just an unmatched experiential opportunity, which we very much did experientially in person, on the ground, moving towards virtual models more so now, where employees get a chance to put their talents to good use. 93% of participants in our programs developed or improved skills through their experience. And then that host organization or the community impact, the organizations receiving teams of employees are really feeling the value of it in that outside corporate lens. 88% report that they really saw the Global Pro Bono program as a change agent. It made them think differently, act differently, and we have some more impact stats on that in the context of the challenge later. And then the business impact, back to strategy and why engage. 70% of participants report a new idea that they bring from the Global Pro Bono program back to their work. So that time off of work, working with that organization is well spent and is translated to the business. And in addition to that, it's an opportunity to understand critical markets and drive innovation. So with that is not even close to what it takes to explain what Global Pro Bono is, but we wanted to get a little gauge of where you, the audience, are as it relates to Global Pro Bono or skills-based volunteering. So we're gonna pop up a quick poll here. And the question in the poll is simply, are you aware of Global Pro Bono or skills-based volunteering opportunities, whether virtual or in person, at your company? So we've got the poll popped up here. Let's get an idea of the audience. Yes or no, are you aware of global pro bono, skills-based opportunities? Do you have them at your company? Neck and neck at 50% right now. More so on the yes side, it's looking like. Excellent. Okay, so it looks like from there, the majority of our audience today are aware of these opportunities. And the second question we don't have a poll for, but what we'd like to ask in the second question, and you can use the chat for this, is with the programs that you know of, are those programs changing right now in the current context? And if you can elaborate, how are they changing? I expect that many of you will say they're going virtual, but in the current context, are there interesting shifts that you're aware of in Global Pro Bono at your company? We'll take a minute to get some responses there, and I think we will keep going. Underrepresented populations or African-American causes. Great. Alex is going to talk a little bit about that, and we definitely are seeing that shift as well with our clients. And we have some great lessons learned actually from making those pivots, which we'll share in a moment. Okay, please feel free to add more comments here. I'd like to go dive into the Reimagine series. This is something new for us at Pixar Global, and I want to talk about how this all happened and dive into the first challenge within the series. So at the height of COVID-19, about springtime this past year, the Reimagine series came to our minds because we were kind of like everyone figuring out, what is the impact here for our business? What can we do? We have countless programs that address the needs of a particular organization, and we help them meet their mission through Global Pro Bono programs, but that's the mission of one organization. We were thinking, how do we go broader towards systems change? Every day we're hearing about these new symptoms, this fractured kind of system, whether talking about health or other systems in the wake of COVID-19, and it's a challenge for sure. but it's also an opportunity. It's an opportunity to change course, and systems change kept coming back to us. So what we did was over those few months, having conversations within our network, we decided that we could make an impact and identify organizations whose missions possess significant ability to impact a social, economic, or environmental system across the country or across the world. And for the first series, we decided to think, based on our conversations, about particularly the US. So if we go into the next slide, I'd like to talk about, after those conversations, sort of where we landed. Two people in our network who we were speaking to were the National Association of Community Health Centers and Iowa Primary Care Association. Obviously the top one there, national level, Iowa Primary Care Association is at the state level. And they worked with us and spoke to us about, and really gave us an idea of what the on-the-ground challenges were, the challenges that they were facing and hearing about across the country or within their state. And so, based on conversations and explaining, as I did in the earlier slides, what is global pro bono and how might this help? We realized that there is a lot of value to bringing a corporate lens and diverse perspectives to these challenges. And quite honestly, the receptiveness of these organizations to the idea of a challenge was really the ticket towards formalizing this. So next slide. We ultimately had a number of conversations with Iowa PCA and NAC back and forth. And based on these discussions, we came up with the following issue and challenge statement, which is that community health centers, which are providing services to 30 million Americans who otherwise would not have access to health care, are really in troubled times. The COVID-19 crisis has quickly revealed how the absence of strong digital health systems severely limits the abilities of these centers. And so the challenge at hand and the statement that we put out there and to recruit companies around was, how might we reimagine telemedicine strategies to better serve our communities? From there, with the anchor partners on board, again, they're very much leading this process. We reached out to clients that we've worked with for many years, Medtronic Foundation and SAP being two of those. And we really didn't look back from there. Medtronic Foundation was at an interesting point in that they were doing some global pro bono for immediate COVID-19 response, training of trainers for nurses in healthcare. And on the other side of the spectrum, what they wanted to look at was systems change, like us. SAP always open to innovation and programming. They have many programs, a social sabbatical program being one of them on a global level, and we're very in tune with understanding and partnering with Medtronic Foundation on this. And from there, we again had conversations with our network, put this challenge statement out there, and got Celanese and BD and Co on board. And so this is the journey of, how this came about, and the model is always reflected in those conversations. So the Reimagine Series challenge is essentially the anchor partner proposing a challenge to be addressed by corporate teams. We ended up with 5 participants on 4 teams, and we had 2 tracks, one for NAC, National Association of Community Health Centers, and one for Iowa PCA. And those teams were multi-company. So you had a BD person, a Medtronic person, an SAP person, and a Celanese person all on one team, which was a really interesting opportunity for obviously networking. And they engaged over 4 weeks to come up with solutions to challenge statements. Now this slide, I'm not going to go into too heavily, but just to give you an idea, if you look on the left and right end there, the challenge, which took place in August, required about 3 months of planning and scoping. I'll get into that a little on the next slide, but from May to July was really the corporate recruitment, getting people excited about the idea, understanding the value of the opportunity, and then putting together a scoping package so that the teams could dive right into the challenge over the month of August. And September and up until now, we are working on solution implementation and next steps. And if we go to the next slide, I want to take a quick minute to talk about sort of scoping. this is the most important foundational step that we had with Iowa PCA and NAC in terms of having definitely workshops, but a lot of self-led work in between. The time put into the scoping process really helped us achieve a solid scope of work for the teams to basically then attack and work on in their multi-company teams. There's a number of tools that are listed there that we used with the partner to actually arrive at that scoping package. So when the teams went into this challenge, it wasn't a blank slate. They had a period where they were already able to see and understand some of the key considerations, the obstacles, contextual difficulties, anticipated impact, and potential deliverables. And honestly, of all of those, it was really hard for organizations to open up. It's hard to be an open book about the obstacles you face, the silos that you might have internally. But that was the key to the team really understanding the problem at hand. And I will not read through these because I want to be mindful of time, but for the NAC challenge, if you read the objective and the anticipated impact here, the teams were really working on something that was internal to NAC, something that was helping them understand with their already amazing reputation, how do they navigate this landscape of telehealth that seems to be changing month by month in terms of reimbursements and access. And the impact would be that they're still that go-to resource for their members, across the nation. For Iowa PCA, the objective was a little bit more focused on specifically the state of Iowa. How do we roll out telehealth? How do we build a step-by-step guide for a primary care association to support all of those community health centers on the ground as it relates to telehealth? From the participant side, a couple of events that were really key, voice of the customer and panel presentations. We had about 19 different stakeholders that were part of the panel presentations and voice of the customer throughout the program. This is really, really important to have, especially on the front end of the challenge, because no solutions are developed without input from everyone from government level stakeholders to patients. And this is just quickly, the mantra that came out of all of this is that if you've seen one community health center, you've seen one community health center. There's a lot of nuance as it relates to the differing needs and capacities and constraints across the nation for each community health center. In terms of judges and winning solutions, at the end of 4 weeks, we had judges that were comprised on each track of 2 people from the anchor partner organization and 1 person from our sponsoring companies. And the solutions for NAC, the solution was building upon NAC's reputation in policy and advocacy and really helping NAC to set a standard across the nation to collect benchmarks and to also grow its network and understand what the return on investment was here for this plan. And for Iowa PCA, it was all about creating a cohesive telehealth strategy across the 13-member community health centers and recommending actual technology and software that could be a part of the telehealth rollout. And as I said before, it doesn't stop there. The next steps right now are more judging. One of the things that is happening with Iowa PCA, for example, is they are taking the solutions from this challenge and resending them out to some of those same stakeholders who are part of voice of the customer and panels to look at the version 2, the version 3, the version 4 of the solution. And Pixera Global is supporting those anchor partners in building out a plan for the next steps. Basically, project management. How do we roll out some of these ideas and potentially move to pilot? And we'll be sending some details for you at the end of the presentation about a webinar. One thing I wanted to point out is that there are long-term impact conversations as well planned for next year to understand how this challenge kickstarted solutions.
All right, great. Thanks so much, Hosna. Now, we briefly wanted to highlight 2 program innovators and our corporate partners who have pivoted or created new strategies for global pro bono engagements in the COVID reality, an effort to support their communities and leverage the power of their employees. And that's with 3M and NBC Universal. So the first with 3M here, in coordination with our partner, Megan Ferrisy at 3M, we pivoted our strategy and developed a new program building off of the mission of 3M Impact, which is their signature global pro bono program. It's called 3M Impact Healthcare, and it actually launched this week. So once COVID hit, like so many of our programs, 3M canceled 10 of their teams launching in 2020, spurring the need to design a new and innovative program to address the times and stretch the program outside of 3M's pillars and into the healthcare space. On May 25th, the killing of George Floyd further challenged 3M Gives team to expand the focus of the new program to address challenges faced by underrepresented groups globally. So the initial idea was around how can we engage with healthcare organizations in the US through 3M employees while also addressing issues of social injustice. So this program engages those who were not directly working in PPE manufacturing or improving global supply chains, which was part of 3M's support for managing COVID-19. So from July to September, we designed the program, which resulted in 4 primary objectives: engaging global alumni of the 3M Impact Global Program in a more advanced skills-based volunteer project in which participants will develop and practice culturally conscious leadership skills while also building the capacity of healthcare organizations to address healthcare inequalities and, lastly, support social justice and racial equity in healthcare. The other example is with NBC Universal. Our recent partners, Jessica Clancy and Milan Stark at NBC Universal, came to Pixar Global this spring to co-design our first global pro bono engagement together. And what resulted is the Summer of Service, a 2-week accelerated program in which employees from their legal department were allowed to contribute up to 16 hours of their working time to assist in accomplishing a discrete, time-bound capacity building project with a partner nonprofit organization. So their legal department had identified the desire by its employees to contribute to causes like inequality and social justice and systemic racism during an uncertain time in which staying grounded and positive had become pretty difficult. Although NBCU's CSR department, NBC Unites, provided other small volunteer opportunities, their legal department wanted to explore a longer engagement with its nonprofit partners as a way for employees to connect with a sense of purpose, offer support, and raise up the voices in the communities in which they live. So in addition, the legal department saw this pro bono engagement as a way to satisfy the intellectual and human curiosity of its employees during a time with limited opportunities to getting out and experiencing new things. So in partnership with us and NBC Unites, the legal department assisted 11 nonprofits on 16 projects and created a vast array of tangible deliverables in just those 2 weeks. Now, if we move on, wanted to touch on some lessons learned as a result of this pivot into the virtual reality post-COVID-19, but also that draws on our experience as leaders in the space. And there's 3 main categories we want to dive into. The first is around internal partnerships. The second, mindfulness and authenticity. And then lastly, external partnerships. So before engaging potential strategic external partners, it's really critical that we align internally first. So looking at our first lesson learned here is to use your best assets and believe in the power of virtual engagement. To us, a company's best resources are its human capital, the people power, their ideas, skills, expertise, passion, values, motivation. So trust in their abilities to drive global pro bono, to build the community trust and provide tangible solutions to your social sector partners. And without a doubt, back up a bit, and without a doubt, virtual engagements are definitely different than connecting face-to-face, but they work and provide opportunities to connect with people all over the world with the click of the mouse. So we want to harness that virtual power during this time when it's so hard for any of us to meaningfully and purposefully connect with the world outside our homes. The next one, of course, trusting in your employees to do the work is step 1, but listening to your employees and understanding their passions, values, and motivations is a close second. Some of our strongest and most successful in terms of the number of employee applications or the satisfaction with their experience or the measured growth from the engagement stem from programs that are driven by the company's employees' passion. For example, one of Moody's CSR and therefore global pro bono focus areas, activating an environmentally sustainable future, not because environmental sustainability is a core business function of the company, but because their employees determine this principle and value is essential to them. So we want to listen to their passions and values, but also hear what their constraints are and design around them. For example, seeking to understand how much time and brain power they might be able to commit to a given project in a week. Then the last one in this category is the more you're connecting your global pro bono programs to your engagement strategy, the stronger and clearer it will be to those participating on the employee side, on the nonprofit side, and the greater the draw for leadership and bringing along other critical internal partners. So for example, JP Morgan Chase's Service Corps program supports the firm's existing grantee partnerships, and their teams of global pro bono participants return to cities year after year to provide continued support to the social sector ecosystem. Last year, they sent their 10th team to the city of Detroit, strengthening their strategic partnerships and building trust in the social sector community. This year, JP Morgan Chase pivoted and launched a virtual Detroit team to continue that support to the Motor City. And then moving on, yep.
So our second bucket, and I've put in the chat that if you have questions as you go through these lessons learned, please do share them in the chat. They will be linking into the second half of our session here. Second bucket, mindfulness and authenticity. Maybe during the pandemic, you have been practicing mindfulness. I think it's a great tool. Also important in program design and reaching out for community partnerships and engagement. Let's go to the first, which is recognizing the constraints of the community and being ready to hear no. Don't want to start on a negative note, but I think it's important to say that this is a tough time. In talking to community health centers, even to working with Iowa PCA and NAC on this challenge, it does require them to define the challenge, and that requires simply time. In some cases, they don't have that, or it's not the right time. So be okay with hearing no, and be really ready to hear what the constraints of the community are and figure out when is a good time for them to engage with some of the unexpected things that are coming their way. Unexpected may be an influx of funding, or it may be dealing with layoffs. The second one here, being ready to invest in problem identification with an empathetic ear. You already heard me go through how long we invested in scoping. If you have a particular issue and community partner in mind, as we learned, for example, on systemic racism pivots recently in programs with companies that we're working with, you really have to understand what you want to do and make sure that you're listening to them and understand, what is expected in terms of solutions and deliverables. Speak to the organization about what they want and don't assume. And then lastly, be specific or risk coming off as inauthentic. This relates to the last one. So, there's an opportunity here to engage with the community, but in looking at that opportunity, you have to make sure that you're not potentially coming off as a company who's greenwashing, or as we have heard recently, woke washing. Woke washing is when brands or companies have started using sort of these progressive values as a marketing ploy and kind of appropriating social activism as a form of advertising. Really walk in with an idea of specifics, why you want to work on a particular issue area. For example, with systemic racism, is your strategy focusing on policy? Is it focusing on economic mobility? Is it focusing on police reform? Who do you want to work with, and why is it critical for your company and your employees? And be ready to, really walk the talk. And finally, the third bucket is external partnerships. If we go to the first one here, this is kind of a no-brainer, but think about your business allies. Think about the relationships you want to keep, the ones you want to form, and don't be afraid, as 3M did, to go into new industries for a particular strategic reason or for particular partnerships. Medtronic and SAP coming together, medical technology, made all the sense in the world. And this opportunity is a springboard for further business relationship building. So make sure you keep the end in mind in terms of business relationships and partnerships if you want to especially go the multi-company angle. The next one is just to leave your footprint, whether that's a local one, a national one, or a global one. The Reimagining Community Health Systems Challenge was really both, and I would say maybe all three even. For Iowa, it was a local state level. For NAC, it was national level, and the impact can be national. Those impacts can also be taken to a global sphere. Keep an eye. Medtronic, for example, was doing particular communities and focusing on particular areas such as Minneapolis, but they also wanted to look at something with national impact, hence part of their motivation to join this challenge. And finally, we have be inclusive. This is a word and phrase that you're probably hearing a lot of, and it is really important, but also to close the feedback loop. As I mentioned before, for the Reimagining Community Health Systems Challenge, we had over 19 stakeholders, internal, external, government, from patients, community health centers, leaders, to really give input into solutions. Do not forget about those folks when it comes to piloting solutions. So right now, for example, with Iowa PCA, those same stakeholders who are part of the 4-week challenge are being folded back in to the solution development process. If everyone in the ecosystem of stakeholders is part of the solution building, they're more likely to buy into the actual solution. And to be clear, coming out of the challenge, we're not there yet. The solution needs that version 2, version 3, and to get more feedback and close the loop on that before implementation.
Great, thank you, Hosna. Now we're moving on to the second part of the program, where we want to shift into the workshop and put you in the design seat. So this will be primarily individual work time to explore your company's strategies and think about designing a program to address this moment in time. Then we'll come back and ask pressing questions either to Husna or myself or to your peers on the call. So taking a look at the instructions here, we're dropping in the chat right now the worksheet. And the workshop, and this worksheet is split into 3 segments that align with the 3 categories of lessons learned that Husna and I just presented on. For each segment, we ask you to explore foundational design questions. So these are questions that we ask when we're planning and strategizing with our clients. And these will help guide you to a final approach and program model when you're trying to understand how to either continue or perhaps start your community engagement efforts. So while these questions should be posed to various stakeholders across your company, today it really is starting with you. And if you don't have a specific company insights that you're trying to answer, pick any Fortune 500 company and try to put yourself in their shoes to get an idea of how they might respond to some of these questions. So pick a few questions in each segment. Don't feel like you need to rush through and do them all now. This is just to start the brainstorming process. Jot down some notes or questions that you might have for the group. We're going to come back in about 5 minutes. We're going to put ourselves on mute right now, but if you have questions for Husna and I, you can pop them into the chat. But right now, on the next slide, we're looking at the first couple of questions in the internal partnership category. All right. Hello, everybody. Let's come back. I hope you were all able to access the worksheet. All right, let's start. If there's any questions regarding these 4 prompts here, or anything that you'd like to share or kind of brainstorm with the group, you can either type in the chat, or since there's just a few of us on, feel free to come off of mute and ask us your question. Don't be shy.
We have a couple of folks on. Was someone about to chime in?
This is Alexa Miller with the Chamber Foundation. I can definitely chime in on number 2, but I don't know if we want to get out of order.
No, that's fine. Was that, Alexa, can I ask, was that the easiest question to answer of these 4? Because we're not expecting that everyone can answer them. That's part of the discovery process here.
Yes, I think it was easy, but it's also easier for me to think about my department versus, like the US Chamber at large, just because we are so fragmented. I mean, right now, literally, we're all at home, but we have regional offices and global as well. So, I really can't even speak to what's going on beyond DC because, just the decentralized aspect. And obviously my department is solely focused on social impact. But I think from an organizational standpoint, the issues that we are really focusing on right now, kind of as we're planning our annual conference, are thinking about those populations that have always kind of been subject to systemic barriers or, like historically marginalized, including like the aging population. And I think it kind of builds into, at least like in the worksheet, some of like the being mindful and authentic in regards to historically marginalized populations.
Excellent. In terms of that population specifically, what's sort of the issue area then? What's important to you all right now specifically? Because you're definitely answering some of the other questions, which is great. What's the issue? Because I can definitely think of more than one as it relates.
I know. Well, we've talked about mental health and isolation through this conference, but we've also recently done some programming in environmental justice. And both of those are kind of heavily partnership involved, at least if we were to be engaged on the topic, just because we are more of the convener than the implementer.
Excellent.
So I think that's kind of the obstacle as well.
Yeah, definitely with the foundation as the convener, I think, if I can give you a little taste of our journey, and in fact, we've got 2 of the right people on the call here. I was leading diversity and inclusion efforts, and Alex is a member of the environmental working group at Pixera Global. And so thinking about particular populations, years ago, we kept on having the aha moments of, no, these are connected. And so some of our programming, we're translating, whether it's internal initiatives with our staff, or prompting our clients right now to think of connecting what would seem like big, hairy issue areas like racism and the environment. They are completely intertwined, and we're, sort of coming back to the design process. How do we, even with separate programs, bring different companies to the same platform to talk about those barriers? Because that overlap seems obvious, but with global pro bono programs, you're actually sitting there working on the issue with, as you said, sort of that specific population. So there's a lot of lessons learned for further program design and kind of making those connections.
Yes, definitely. Perhaps we can move on to the next bucket. All right, fantastic. So again, we're going to all work on this individually. These 3 questions here. We'll come back in a few minutes and discuss.
And if you have already started on the other questions, we might actually even stay on. Alex, maybe we'll just stay on video, give people a couple minutes to jot some answers down. But you know, as Alexa did, she sort of was specific about the social issue and the population, which relates to footprint. But I really like this second question, if it's possible to really hone in on that. What's the risk of not acting on that issue? And what are the possible risks when acting on it? And if you remember back to the greenwashing, woke washing, do you feel like you're concerned about perception of some of the maybe potentially new actions you're trying to take? I think this is definitely something that's come up when we're talking about systemic racism, racial justice programming. How do we approach it in an authentic way?
I think something that came to the forefront for me kind of when thinking about this, especially reflecting on how we've discussed internally as well as with partners, is just being transparent on the fact that this is a new place and we are trying to explore. It's like being authentic in just your naivety, I guess.
Absolutely. Building on that, Alexa, it reminds me of an example just from a conversation a week ago, where the way that I was able to talk about stepping and pivoting into this new area with a client was by talking about the Pixar global journey again. We recently put out a statement, as have many other organizations and companies, on systemic racism. And you know, the question within our staff is, okay, what next? What do we do? How do we act? And we are putting together a framework and figuring out what makes something a priority versus something we might look at down the road. Are we honing in on a specific issue? And you know, everyone's got different thoughts on that, and we have at least done some of the foundational work to put together a task force around that. So just talking about sort of the ups and downs of the journey and just being transparent about what we're learning and that we're still learning in the process has been an exceptional way to kind of start off the conversation, is being humble, for sure.
And I think there's clearly a risk to not acting and not talking about it, to, I mean, just because if you're not public about it, I think people already just kind of start to think that that means that you don't care. So it's almost hard when you know that you don't know, but you want to act. I think that as an organization, that's probably like, you know, the double-edged sword.
Absolutely. Trying to figure out what is more important, getting a message out quickly and clearly, or taking some time to digest and think and hear from stakeholders, refine. I mean, the number of times we refined our statement before putting it out. Yeah, it's a lot to consider, and certainly a double-edged sword.
And we are just affiliated with the political organization, so there's also that. And I know that you know, so many companies have you know, governmental affairs and a huge presence, at least like on Capitol Hill, from an advocacy standpoint. So, you know, unfortunately, there are those competing priorities, if you will, or even just, you know, figureheads that can serve as like the obstacle when policy's at play.
Certainly.
Yeah, and when we say be specific as possible, we know that is also hard, but I think in trying to drill down and exploring a particular topic, going back to the first set of questions that actually can help you get more specific. It's what are your assets? What's important to the business? Where have you succeeded or failed previously? That's one we didn't put up there because that's we need another workshop for that separately. But, thinking back about your core business, what's important there will sometimes help you narrow down to specificity. That's the approach we recently took with a client. But on the other side of it, it could be, where do you want to delve into? That is new, and that is going to be bold because maybe you haven't been bold enough in the past.
Yeah, definitely. I think perhaps we should move on to the last group of questions here in regard to external partnerships.
And for the others on the line, you don't have to come on video if you don't want to, but please do feel free to chime in, ask questions. As you're going through these next set of questions for external partnerships, I am sure many of you can think of community-based partners you already work with, or maybe you work with one on your own, your family, you've done some volunteerism, and you'd like to talk through how do you build a partnership with a particular organization? How do you even get started on that kind of thing? So we'll give you a couple of minutes and we'll stay on the line. Anyone has experience also being part of any multi-company initiative or having skepticism about multi-company initiatives, I'd love to talk through that as well. I'll be honest and tell you there were a couple folks in the challenge during week 1 who said, I'm really good at IT and this is what I do. Can I go with all of my other IT folks and go, help Iowa PCA figure out how to roll out telehealth across the state? And we said, no, that's not the design, but also it's an intentional design. It was quite a journey for that person and for the organizations to be able to articulate how valuable the multi-company diverse skill set approach was to the challenge. They probably would not have come up with the same deliverables in the 4-week period. And I think I did not mention, forgive me for this, but this was not a full-time engagement over 4 weeks. This was approximately 5 hours a week. So it's a very limited time in which to come up with, a business plan for a national organization like NAC.
I think with multi-company initiatives, and as I'm kind of reflecting on the hackathon project that you guys did, it probably is I'm not going to say it's the limited time commitment, but the fact that you can't be fully immersed in it at all times kind of probably does limit the creative thinking that could have happened, kind of across the board when you're thinking about big company, multi-company initiatives. And there still needs to be kind of that one person that's driving all of the engagement and making sure that all of the voices are heard kind of continuously, which I think is lacking sometimes with some like today we heard about this program called Raising Good Gamers. Like, well, when you're working with young people, academics, Fortune 500, multiple Fortune 500 companies, like still someone has to be designing that program and driving that forward. And oftentimes I feel like that's not really the case. It's just like the one person from each sort of coalition.
Mm-hmm. We did have, within the teams, we suggested a team lead, which ended up being instrumental for Pixera Global to communicate with that person. It is a huge responsibility. I think, again, having learned lessons ourselves through this process, it's a huge responsibility. It's potentially something that could be rotated through different people. But one of the ways that we got past sort of the time constraints was doing a lot of asynchronous recordings to kind of keep the momentum of the team going, give them that push, make them feel like they're on the right track, or just to send them a couple of updates. We had, for example, a couple telehealth experts who were able to join us from Medtronic and outside of Medtronic. So we said, hey guys, we've got some speakers that might be able to especially help the Iowa PCA team who are focused on actual technology to get some insights and use them as a sounding board. So we'd send out little 3 to 4 minute recordings to keep them on the right track. And also had some one-to-one time with the team leads. I absolutely think that the team leads did drive things. It's a little like that school project sometimes when you end up having one person help lead things, but it was an integral role and helped them get to the finish line.
Yeah, you definitely have to have a skill set for that too.
For sure.
Absolutely, and it's an opportunity to build the skill set too. A lot of people came away with, I didn't think I could do that across multiple people from different companies. It was daunting. But it was a great experience to throw myself in there. Any other thoughts, questions about the questions that you see here regarding external partnerships or about the Reimagining Community Health Systems Challenge itself? And Lawrence, if you can give me an idea of whether we have a couple of minutes here or just a minute or two, that would be great.
So I stepped in for Lawrence as far as the administration support goes too. So we're at 105 now. I think it kind of really just depends on what the group's thinking and your guys' availability. But I'll take your guys' lead if you want to, provide any final thoughts and kind of action items, next steps. I know I had joined late, but there are, things moving towards more sort of hackathons on different social issues too.
Absolutely. So the health challenge is the first in the Reimagine series for Pixera Global. We have a number of conversations going with other, partners in our network who are able to sort of lay out what the issues are, what are their constraints right now. And we're sort of starting the same place we did with Iowa PC and NAC with some of those organizations to help define what their challenge is and understand, is this an opportunity where multiple corporate perspectives would make sense over the course of, let's say, 4 to 5 weeks, contributing to a solution. I think the other piece of this is for people who have not done skills-based volunteering before, they're very eager to continue. For example, BD and Medtronic are both looking towards solution implementation, which likely in the coming months. And how can they contribute? How can they continue to have employees contribute to the piloting of solutions? So that culture of volunteerism, maintaining that at this time is hard. We're used to having immersive volunteerism programs, and there's still an opportunity, and I think immense value that organizations are saying in the virtual format. Guess we can go ahead. Any other final questions, thoughts?
I think they're all deep in thought. And perhaps we can share in an upcoming webinar that we're doing.
Yeah, so if you have questions, the Reimagining Community Health Centers challenge, the first in the series, as I said, it's best to hear it not from me, but straight from the source. We have participants who are part of the challenge, as well as Jason and Sarah, who are part of the anchor partners, NAC and Iowa PCA, are going to talk about the experience from their perspective. And I think for me, the most important part of this webinar is that they're going to be talking about the next steps and the impact. Alex has put the registration link over there in the chat. Highly encourage you to register for this. and hear about what comes next. So we had this competition. There's some brilliant solutions on paper. NAC and Iowa PCA are poring over all of the solutions, not just the winning ones, to come up with that version 2, version 3. But really, what comes next is Iowa PCA rolling out telehealth in a new way across the state. You'll hear from Sarah and Jason on a national level about what those next steps are. And if you are, and we can go to the next slide, interested in keeping in touch with either one of us or talking about building out your own challenge or joining a challenge, please see the screen for our email addresses, and feel free to take a look at our website. You'll be bombarded with more Reimagine series items, as well as a couple of other webinars we have coming up. Take a look, and we thank you for joining us today.
Everybody.
Thank you.
Thank you.